Here are 3 USMLE-style multiple-choice questions focused on secondary syphilis, each with 5 answer choices and full explanations for the correct and incorrect options. Question 1. Clinical presentation. A 33-year-old man presents with fever, malaise, and a non-pruritic maculopapular rash that involves the palms and soles. He also reports generalized lymphadenopathy and has moist, wart-like lesions on his perineum. He recently engaged in unprotected sexual activity. Which of the following is the most likely diagnosis? A. Rocky Mountain spotted fever. B. Secondary syphilis. C. Hand, foot, and mouth disease. D. Disseminated gonococcal infection. EHIV seroconversion syndrome. B. Secondary syphilis. Classic findings include systemic symptoms, palm and sole rash, condylomata lata, smooth, painless wart-like genital lesions, and generalized lymphadenopathy. Why not the others? A. RMSF. Rash includes palm soles but usually follows a tick bite, begins on wrists, ankles, and is associated with severe illness. CHFMD. Typically affects children, caused by Coxsackie virus, includes oral ulcers and vesicular rash. D. Gonococcal infection. Can cause arthritis dermatitis syndrome but not condylomata lata or palm sole rash. E. HIV seroconversion may include fever and rash, but rash is usually macular and not localized to palms, soles, or genital lesions. Question 2. Diagnosis and testing. Which of the following best confirms the diagnosis of secondary syphilis? A. Positive VDRL test. B. Positive RPR test. C. Positive treponema pallidum particle agglutination TPA test. D. Visualization of multinucleated giant cells on Zank smear. E. Positive ELISA for HIV. Correct answer C. Positive treponema pallidum particle agglutination TPPA test. TPPA is a specific treponemal test used to confirm syphilis after positive non-treponemal tests, e.g. VDRL or RPR. Why not the others, A and B, VDRL, RPR? These are screening tests, non-treponemal, not confirmatory. D. Zank smear, used for herpes viruses, not syphilis. E. ELISA for HIV, not relevant to syphilis diagnosis. Question 3. Disease progression. If left untreated, what is the most likely outcome following secondary syphilis? A. Immediate progression to neurosyphilis. B. Spontaneous resolution without any further complications. C. Progression to latent syphilis with positive serology but no symptoms. D. Development of fulminant sepsis. E. Chronic reinfection with genital ulcer disease. Correct answer, C. Progression to latent syphilis with positive serology but no symptoms. After secondary syphilis, the disease may enter a latent phase, where the patient has positive serology but no symptoms. This may later progress to tertiary syphilis. Why not the others? A. Neurosyphilis, possible but not immediate, occurs in some later stages. B. Spontaneous resolution, symptoms may resolve but infection persists. D. Sepsis, not a typical complication of syphilis. E. Chronic reinfection. Reinfection is possible, but not typical without new exposure. Let me know if